Autism Awareness Day is observed on April 2nd every year to make people understand and accept people with autism, foster worldwide support, and inspire people. It is a day that spread kindness and autism awareness. The theme of the World Awareness Day 2022 is inclusion in the workplace. Inclusive education is the key to transformative promise of the Sustainable Developmental Goals. Leave no one behind. Hi, welcome everyone. Thank you for joining us for today's webinar. Myself, Raghavan Joshi, Associate Professor, Department of Psych and Nursing, Sarvodaya College of Nursing, and also moderator for today's webinar. Today we are conducting a webinar on account of World Autism Awareness Day, and topic of the webinar is inclusive quality education for all. And today's resource person is Dr. Hemlata R, founder of University College of Nursing, Bangalore. There is limited capacity on Zoom. I request participants who are unable to join using Zoom can join the YouTube, which is a link shared. Yeah. I request the participant to kindly keep your mic mute during the session. If you have any questions during the presentation, please type them into the chat box. So I'll bring them up at the end of the session to the resource person. E-certificates will be mailed to the participant who submit the feedback form. And now, without delay, I call upon Professor Jolly Joseph, Vice Principal, Sarvodaya College of Nursing, to welcome the gathering.
A warm good afternoon to everyone. It gives me immense pleasure in welcoming you all on behalf of Sarvodaya College of Nursing, Bangalore. Today's webinar is organized by Department of Child Health Nursing as a part of World Autism Awareness Day. First of all, I offer a hearty welcome to our resource person, Dr. Hemlata R, Principal, Universal College of Nursing, Bangalore. Ma'am, I feel personally very honored to welcome you for today's webinar. I extend a warm welcome to our respected chairman, V. Narayana Swami, and our managing directors, Mr. George Thomas and Mr. Sunoj Matthew, who have always encouraged the need for knowledge enhancement. I welcome our dear principal, Dr. Dinesh Selvam S., who is the motivation and guiding force in organizing today's webinar. I extend a warm welcome to Mrs. Remya, our nursing program coordinator. I also extend a hearty welcome to all the teaching faculty and students from various nursing institutions who are participating in today's webinar. I also welcome our teaching, administrative, and students from various the students and also the technical staff who have extended their support in organizing today's webinar. I'm sure you all will have an engaging and enriching session ahead. Welcome, everyone.
Thank you, Jolly ma'am. Now I call our dear principal, sir, Dr. Dinesh Selvam S., who is going to address the gathering.
Good afternoon, one and everyone who have gathered for this afternoon for the session of webinar, which is being organized to mark the awareness of World Autism Day. Actually, it was on April 2nd, and we are organizing a awareness event for all the students and all the participants who have joined here through webinar. First of all, I like to extend our greetings from our management, our dear chairman, Mr. Narayana Swami, and also our directors, Mr. Sunoj and Mr. George, and other management faculties and from the staffs of Sarvodaya College of Nursing and Sarvodaya School of Nursing. So this autism, you all know that it is a neurodevelopmental disorder. Actually, it is characterized by deficit in social and language communication, also affected behavior sort of thing. And here the children and adults are also with the autism spectrum disorder. They have wide range of abilities. They cannot speak, and some of them have other kind of abilities. Some of them have a very limited verbal communication. And absolutely, it is an impairment in their cognitive thinking. And regarding this autism, we want to know more about it and what as a nursing faculty we can do in the management and in the prevention of autism. This is what the World Autism Day actually focuses on, where to create awareness. And being in nursing faculty and nursing domain, it is our responsibility to update and also to know what are the various modalities to take care of this autism in the community. This World Autism Awareness Day comes with different theme in every year. And for this year, it is the theme like inclusive quality education for all. And I think roughly, according to 2018 statistics, 23 of every 10,000 children in India have autism. And this particular theme, which has been selected as inclusive quality education for all for this year, mainly also focuses on because of the onset of COVID-19, where schools were shut down and there were various classes happening on online. And this kind of impact, it should not also affect the students who are suffering from autism. That was also the main thing. So the theme mainly for this year highlighted on how more we can provide and an inclusive and a quality education for all the people with autism, and also remove the stigma of autism. So to talk more about this and to talk in detail about this, we have with us our dear ma'am, Dr. Hemalata. Ma'am is very much, very enthusiastic, and I have observed ma'am for long years, and it's very special to have you, ma'am, among us for this webinar session. And I hope this session is going to enlighten with all your expertise. And I can also understand your passion on working with this linguistic developmental disorders children, and your work towards it, which actually attracted us to call you especially for this session to enlighten about the not only your work and to also to give awareness about autism to all the participants who have joined. And I think among all the webinars, I even released this webinar title only one day before, but I am saying, I don't know how I reached around 500 registrations by yesterday evening only. And we have planned only for 100 people to join in the Zoom. And this is the first time where 500 reached within a day of our announcement. Actually, we used to have around 250 and 300 to tell frankly the registrations, but really it's good. And we are happy to have you for this day. And we have so much of respect and regards to you. And we are looking forward to you for presentation of your topic. And only one announcement, I want all the participants to be on mute and also video off. I know that ma'am is going to take a very good interactive session. So whenever you want to interact, you can unmute yourself and you can talk with ma'am. And other participants who are not able to join, I started receiving more messages that they have been not able to join. We will provide you the YouTube link even in this chat box. Please view this in the YouTube also. It will be more interesting. That's what to Joshi to continue to moderate the session.
Thank you, sir. Now it's time for me to introduce our today's resource person, Dr. Hemalata R. She's a founder, Satori Coaching and Training, and she's also a professor cum principal, Universal College of Nursing, Bangalore. Ma'am has completed a BS Nursing from PGI, Chandigarh in 1993. Ma'am also completed MS Nursing with specialization in pediatric nursing from SNDT Women's University, Mumbai in 1997. And ma'am also completed PhD Nursing from National Consortium for PhD Nursing under INC and RGHS. Ma'am has held many positions such as Academic Council member during the 2015 and 16 in RGHS. Ma'am was a BOS, UG and PG member in multiple terms. Ma'am also was also a member of faculty in RGHS from 2016 to 2019. Ma'am also BOS member from Dayanand Sagar University. And Madam has accomplished many milestones in the field of nursing.
She developed the first BS nursing curriculum in University of Asmara, Africa, at the age of 27 years. And ma'am has developed the nursing graduates' competencies and the tools to assist them in India, and also associated of a groundbreaking longitudinal research project on health insurance in McMaster University, Hamilton, Canada. And ma'am also distinction in PhD nursing under INC. Ma'am also was a university rank holder in MSc nursing and published 15 papers in national, international indexed journals. Ma'am also being a PhD guide in multiple universities. MAM mission is to create a world of infinite possibilities for children, teens, and young adults, and for each one of us live a life of utmost joy and freedom. She believes that every person has the potential to learn and excel. They just have to look and allow the light to shine from within. Her brand, Satori, is a Japanese term meaning inner, intuitive experience of enlightenment, inexplainable, indescribable, and can be a sudden. Ma'am has many credentials from the world of NLP, that is neuro-linguistic programming, and she is a certified neuro-linguistic program master practitioner from NFNLP USA, NLP transformation coach, accelerated learning skills coach from Norway Academy, and certified trainer from Bodhi Consultancy. People that she works with, mostly children, teens, adults who are having dyslexia, ADHD, autism spectrum disorders, and anyone who wants to excel in learning, children and young adults with confidence, stage fear, self-esteem issues. Apart from coaching individuals, Dr. Hemlata also leads fun creative workshops for teaching faculty, professionals from different fields, children and different groups, helping people discover what they really want, and also to excel and taking their life and career to the next level and being confident and courage in being themselves. Ma'am is passionate about to create a Disney space in coaching for people to enter, find joy, freedom in being themselves, feeling authentically confident, and learn to excel in their personal life, academics, career, and when they leave the space, they live a life that is fulfilling, free, and happy. Over to Dr. Hemlata, ma'am.
Thank you so much, Mr. Joshi. Thank you so much, Dr. Dinesh Silvam, Principal, Sarvodaya College of Nursing, and Jolly. So thank you so much for inviting me to Sarvodaya through the virtual route. I have a long association with you and also with Sarvodaya. Actually, we met in Sarvodaya, right? I worked in Sarvodaya for nearly 2 years, and it was one of the best moments of my life. I loved working in Sarvodaya. I still remember our chairman, Narayana Swami sir, Narayan sir, all the teaching faculty there and the students at Sarvodaya. And many of the people who are the, I think, part of the management now of Sarvodaya were my students. So I'm so happy to meet all of you through this virtual route. And I hope that we can engage effectively on, spectrum disorder. For inviting me, and especially for this topic, which I'm really close to, I'm really passionate about. Just want to create a world that is accepting of all, that we don't differentiate people based on anything, that where people diverse, people who are from diverse backgrounds, people who are differently abled, everybody has a chance to live and thrive in this world. So thank you so much for this. So I'll just start my talk by just share the PPT before that. I hope you can see the screen. Just put
yes, ma'am. Yes.
So I'll just start. Stop thinking about normal. You don't have big enough in imagination for what your child can become. This is a quote given by Johnny Sades, who was a person with autism himself. So sometimes we think normal, abnormal. So instead of thinking it as normal, abnormal, thinking it as somebody who is different, and somebody. Disability is usually defined in terms of what is missing, but autism is as much about what is abundant as what is missing. And that makes this is Paul Collins, who is also a person who is autistic. If awareness in quality education for all. So having inclusiveness in workplace, having inclusiveness in learning,
dear participant, kindly wait for a few minutes. The ma'am is having the technical issues. We'll be back soon.
Did I get disconnected?
Yes, ma'am.
Yes, ma'am.
Can I
Yeah.
start?
Yeah, you can restart, ma'am.
Yeah. So, autism awareness, the theme for 2022 is inclusive quality education for all. Inclusion in the level at workplace, inclusion in schools, inclusion in hospitals, inclusion in every aspect of our lives is the theme for this year. So let us, I don't know whether you will recognize, I'm sure you will recognize this young lady here, and I don't know how to recognize the left. So this is Elon Musk. He's the creator of SpaceX, which sends people to the space organization. He is the founder of Tesla company. This is a company which produces vehicles which are fuel efficient.
Ma'am, the slide is not changed, ma'am. Now it is
slide
changed.
Now it's changed, sir?
Yeah. Yes, ma'am. Yes. Please continue.
Yeah. So let me know, sir, if otherwise I'll move to a different space if this is not working. Yeah. So Elon, he's the founder of SpaceX and he is the founder of Tesla. And he famously said that he himself has autism. And you can see that being a person who is having autism, the heights he has reached, I think he's one of the richest people in the world. So the heights that he has reached being a... The young lady here, you recognize her, she's in the UN, where she advocated very vehemently for climate change. And she said that climate change is happening because we are not respecting nature. We are not respecting the weather. We are not respecting the climate. She was an advocate for climate change, and she does not see disability. She sees it as her superpower. The whole slide has changed. We have two people from history who they were not diagnosed as people with autism, but definitely they both had features. So the person on the right, left, I'm sure many of you will recognize this is Albert Einstein. Albert Einstein struggled a lot with learning. He had learning difficulties that was very well documented, but he also had all the characteristics of autism. So Albert Einstein is the world famous physicist, and he was able to accomplish so much in his field, and all that having autism. The person on the right, Sir Isaac Newton. I'm sure all of you know about the law of gravity. Isaac Newton, from the age of 3 or till the age of 3 or 4, he could not speak. He was a non-verbal person who was having autism. So after that, he started developing his speech, and they say that he fit all the characteristics of a person having autism. And you can see what he has accomplished. So let us share some myths around autism. There are a lot of myths around autism, and I think that has contributed to ill health around the world. One main myth around autism is it is caused by measles, mumps, rubella vaccine. So if you see in the Western world, there are a group of anti-vaxxers. They are against vaccination just because they say that there is a link between MMR vaccination and autism. So this myth has been completely shattered. This was done. It was reported by a doctor who did a study, and that doctor himself was removed from practice. So there is no link between measles, mumps, and rubella vaccine and autism. Autism is not a disease. It is not a disease. It is a neurodevelopmental. It is a neurodevelopmental condition. So it would be present. It's a developmental condition. It is not a disease. It could be a disorder. People with autism do not have intellectual disability. This is completely a misnomer that people with autism have intellectual problems. There are some people with autism who are super intelligent. And then there are people who struggle with learning, but there is no connection between autism and intellectual disability. They say that there is a myth that people who have autism are non-verbal. No, people with autism are verbal, or there are few who are non-verbal. There is also another myth that people with autism have, supernatural abilities. I don't know whether you have watched a movie. Please, if you have not watched it, it is one of the best movies that I loved. I think it had even won an Oscar award. That movie is called as Rain Man. Please go and watch that movie. It's a beautiful, beautiful story about a child who grew up into a man who was having autism. And in that, they talk about different features of autism, but there is one ability he has, that he is very good with numbers. He has a superhuman ability with numbers. While that may be true for him, but not all autistic people have super intelligence. So that is also a myth. People with autism can learn easily. This is what I talked about previously, that it is not necessary that people with autism have intellectual disabilities. They can be having very high IQ. They can learn very easily. And most important myth that I would really like to shatter here is all people with autism are not violent. Many people think that if you're autistic, you tend to get violent. There is no link between. So the link between autism and violence is the same as the link between a neurotypical person becoming violent. Okay? So any neurotypical person also becomes violent. That is the same connection between people having autism and violence. So there is no connection between autism and violence. So what is autism? Autism is a lifelong condition and affects people from all backgrounds. There is a data to say that 4 males as compared to 1 female are diagnosed with autism. So autism is more prominent, seen more dominantly among males, but women are also affected with autism. It is estimated that 1 in every 100 people in the world have autism spectrum disorders. This is very interesting because this is the data which exists across most of the countries, that 1 in every 100 people in the world have autism spectrum disorder. Many people are unaware that they are autistic because of the inability of the different countries to diagnose autism. Many people are not even aware that they are autistic. This is especially true of adults. So there are many people, they mask their autism, so they are not able to diagnose that or they may be having a milder form. So they are not able to diagnose them as having autism. What do the numbers in India say? 1 in 100 children in India are under the age group of 10 who have autism. 1 in 8 children in India have some form of intellectual disability. This is the data which is got from 2018 study, and of the entire data which is there in India, this is more relevant and it's more closer to the truth. Autism is also known by other names. It is also called as Autism Spectrum Disorder, which is the diagnosis given with the DSM-5. Asperger's syndrome, it was there with the DSM-4. Now it no longer exists. Asperger's, many people refer the milder form of autism as Asperger's syndrome. Autism spectrum condition and pervasive developmental disorder. So this pervasive developmental disorder was also considered as a diagnosis in DSM-4. Now it is as ASD, that is Autism Spectrum Disorder. Here now I would like to just emphasize on the word spectrum. What's a spectrum? A spectrum is like a rainbow. Okay, you have different colors, you have different levels. The same thing with the spectrum. A spectrum is you can have a milder form or you can have a very severe form. And there is a saying that there is no two autistic people who are alike. So that means the signs and symptoms varies from one person to the other. How a person is affected with autism varies differently. So there is no one person who will have a similar characteristic as another person having autism. Autistic people have differences in the following areas. I'm sorry. I don't know why it is paused. I'll share again. Social communication and social interaction, social imagination and flexibility of thought, restrictive or repeated activities or interests, restricted or repetitive patterns of behavior, and unusual sensory responses. So this actually summarizes the entire presentation of what we are going to do about, how people with autism look, how they behave, how they feel. This entire slide will encompass all of those. So they have differences in social communication, social interaction, social imagination, flexibility of thought, restricted or repetitive interests or activities, restricted or repetitive patterns of behavior, and unusual sensory responses. So I'm going to spend the next 10-15 minutes of our presentation based on this. So first one we see social communication and social interaction. People with autism experience social communication differently. Okay, so it varies again from one person having autism with the other person. So basically, what is affected? It's speech, language, gestures, the body language, eye contact, and tone of voice. Okay, so how is this affected? How does it affect their day-to-day life? People with autism find it difficult to communicate or understand body language. Okay, so one thing what you will see is that when you show certain gestures, they will not know what it means, even if the gestures are universal. Okay, so they find it difficult or communicate, or they find it difficult to understand how a person communicates with the body language. They avoid eye contact, though this may not be true for many people who have autism, but most of the people who have autism initially, when they meet you for the first time, they avoid eye contact because they're more into their feelings. Their tone of voice may not reflect the way they feel. So this is a very interesting thing. They can tell you a joke without changing their tone of voice. So the intonation, the voice modulation may not be strong enough for the people who have autism. So they may be telling you a joke, or they may be telling you something very sad which has happened in their life, and their voice will stay neutral. They may not be able to use gestures or interpret other people's gestures. So if you see, generally people having autism are very still. They don't move their body much. And again, I'm saying this is on the spectrum, so it's not applicable for everybody. Some of them may have that. And they may interpret language literally. So this is very interesting. So if you tell them a particular thing, they will take it as it is. Okay. So I remember when I was speaking to one of my clients. It's a 11-year-old boy who has autism. And I told him that, make hay while the sun shines. I just gave him that, while talking, I just told him, make hay while sun shines. And we spent the next 1 hour arguing about, he was actually arguing with me about how can I make hay? I cannot make hay. So the literal, they take the literal meaning. Okay. And people who have autism experience social interaction differences. So they are not able to interact socially very well. So they find it difficult to build and sustain relationships. They find it difficult to engage in conversations. They find it difficult to give and receive compliments and understand humor. They also do not show much concern for others because they are into their own world. So how does this affect them? So children with autism may find it difficult to initiate or join in play with other children. So this is especially true for children when they are just diagnosed with autism. Most of the times, one of the indicators for parents to reach out to a healthcare provider is because their child is all the time alone, does not communicate with others, or they do not join in play with others. This is one of the reasons why parents would start identifying when the child, they take a child to the park or they take a child to a social gathering and their child does not interact with others. So that would be one of the reasons for the parents to identify it early. They may find it difficult to take turns and share. So they are very, exclusive. Like they stick to their things. They are, they don't share their toys. So they don't interact. Even they don't share their books. They don't share their pens. So they find it difficult to take turns and interact. So this can affect their friendship. And again, the thing is, while it may be true that they don't share much, but it's not that they cannot make friendships. People who have autism can be excellent friends. Okay, but to maintain, to get that going initially takes time, and they don't connect with everyone. Okay, they connect with people whom they feel connected to. So they need to feel the connection. Even if you speak very well and you approach them, you want to be close like parents themselves. Some parents do not connect with their child because their child does not connect with them. So just imagine how a parent feels. Even I have had one parent talk to me saying that the child connects with the mother but does not connect with the father at all. The child does not speak to the father. So it is very painful for parents themselves. They may not engage in conversations in the same way. So they don't have small talk. Okay. So usually what happens is when I do my coaching sessions, I start with, how are you? How was this week? And this is how I generally start. And then I get a sense of how their week was. And then I start the coaching. But what I have seen is this, I've learned with the experience with kids having ASD. I just ask them, how are you feeling now? Okay. I don't ask them, how was your week? They are able to tell how they feel now. They are able to tell what they are facing problems now. But if you ask them over, like, how was it last week? It's not they don't recall. It's not that they don't remember what has happened, but it's just that this feeling, what they are feeling today, is more important for them. So they find it difficult to make small talk. So they'll directly, so I've had kids tell me, shall we start the session? Just openly they will tell, and I'm okay with that because that is how they are. They just children having autism may have difficulty in understanding rules of social relationships. So understanding the difference between, the parents, understanding the difference between a caregiver, understanding between, relationships, they find it very, very difficult. This is not just in children, it even happens in adults. Social imagination and flexibility of thought. Now, why is this important? Need to predict reactions and events, and people having autism may find it difficult to predict reactions and events. Okay, I'll be discussing a little more about this in the next slide. They find it difficult to predict problem solving. They find it difficult to relate to others. They find it difficult to cope with changes. They like routines. They like things being stable. They find it difficult for planning. Why planning? Because they are not planning for the unexpected. They know if certain routines are there, they want to stick to the routines. They don't plan for the unexpected. So how does this impact their day-to-day life? When problem solving, they find it difficult to predict outcomes. See, when you're doing a problem solving, you are looking for different solutions. Okay. And you anticipate, okay, if we have this solution, this could be a problem. That ability is a little difficult in people having autism. They don't anticipate what problems can occur. They can come out with solutions, but they find it difficult to predict what would be certain problems with these outcomes. They find it difficult to, in team sports especially. Okay, how children with having autism can find it difficult is they cannot predict people's reactions. Okay, so say for example you are playing football. Okay, they know how they are playing. They play very well. Okay, but they don't predict how the other person will react, how the opposing team or their own teammates to pass on the ball. They find it difficult to predict how they will come. So they are not able to. So that is where we call it as that imagination, social imagination and social flexibility is, they find it difficult with that. They find it difficult to predict how people are feeling. Okay, so they will not know how people will react. So they will do their thing, they will not know how others are going to react. Some are highly creative and some struggle. So it is a myth that all people with autism are very creative. Some are very creative, but some are, they struggle. The main reason why they struggle is because they are more into themselves. They have an imagination, but they are not able to express that imagination. They find it difficult, as I said, they find it difficult to plan ahead. So many of one way of working with people who have autism is having planners in place, having calendars in place. You can have sticky notes, so that they will be reminded. Having a lot of visuals. Okay, they are very visual. They are very feeling oriented, emotion oriented. So having visual images for them can help them to work well. Even as students, having more visuals for them helps them. And this is something which I've shared earlier also, that people with autism, they like routines. Okay, so even a single change in the routine, they get very, very disturbed. So I was, initially when I was working with a kid, I think it was 1 year back, I was working with a kid having autism. He is a 15-year-old boy. And what happened was, if I give him a time that my coaching session is at 5 p.m., I have to join at 5 p.m. If I join 1 minute later, he gets very stressed. Okay, so he'll message me, ma'am, let me in, and there will be continuous let me in within 1 minute. So he gets very, very stressed because they stick to routines. Even I can't change my session. So suppose I have a session on Monday, if I want to change due to some work or maybe work at college, I want to change my session to Friday. It's very difficult with him. So I have to stick to the routine. I have to keep that session. And there have been times, so this is very, very interesting. There have been times when I've told I could not come for the session. I've told the mother that I'm not coming for the session, and he would join and he would stay on the meeting. He would join the Zoom meeting. He will stay till 5 o'clock and then he will leave the meeting. So they stick to routines and they don't like unpredictability. What are some unusual sensory responses? So some unusual sensory responses are, they are affected. So they are very sensitive to touch. They have a lot of movement. So there are two aspects in this. Some kids make a lot of movement. So you will see them moving their body like this. Okay. Or they'll be moving. You can even hear the sound with the chair. They'll be constantly moving. So some will move like this. Some will be moving like this. So they'll have a lot of movement. Body position. So how they keep their bodies. So sometimes they'll be like this. You can even see a child with autism standing upside down. Okay. I have had one kid standing upside down for the whole session. So they take up odd body positions, which is actually very fascinating because people find it very difficult to stand upside down and all that. But these kids are able to do it very beautifully. They have sometimes the visual senses are affected. Too much of light or too much of darkness can be a trigger for them. So too much of light, children with autism, they're not able to control their emotions. So having light regulation is very, very important. Yeah, this is something very, very interesting and unique to children having autism. They are very sensitive to sound. Okay, and I remember I had a teacher who was a counselor, and he was having autism, and he was teaching counseling for us when I was doing my MSc. And he would, when he comes into the class, he will ask us, even with the fan, the calendar, the paper will be moving, and he would tell us to put on the fan or remove the calendar. Okay, even that minute sound, they can get very much disturbed with. Sound. So just imagine a child who goes to a school, okay, who goes to a regular school, the kind of noise that happens in the school, that is where children having autism get triggered. They are not able to manage the sounds. And so that is one cause of them getting triggered and, them getting violent sounds that they're not able to manage. They are very sensitive to smell. So certain smells, they love certain smells, and there are some children who hate certain kind of smells. They don't want, so certain foods they completely avoid because they don't like the smell and the taste. Okay. Here I also want to say about, in all of this, there is a term which is very, which is seen in many people who have autism. That word is called as stimming. Okay. So stimming, there are different types of stimming. Stimming can be even movement stimming. Okay. Or they will be repeating, like echolalia. You would have learned it in psychiatry. They'll be repeating a certain word, or they'll be making certain movements with either their body, mouth, different parts of the body. They make certain movements. So this is called as stimming. You have vocal stimming. They'll keep repeating a certain word or repeating a certain noise. They'll keep repeating. So that is a very characteristic feature of children who have autism. So how does this impact? So this is, again, as I said, it's very, because autism is on the spectrum. So it is some things impact them positively, certain things impact them negatively. So sensory joy from certain colors. They become happy when you have certain colors. So this kid that I'm currently working with, he loves black. His entire room is in black. Okay. So he develops a lot of happiness. So when I come, and if I've been during my session, he wants my background to be in complete black. Okay. So sensory joy from certain colors. Sensory joy from the feel of certain materials. I remember I told you about stimming. So they have sensory joy about stimming. So when they repeat certain words, they get a lot of happiness. They've decreased, they have these decreased feelings of pain. This does not happen with everyone. Some of them have decreased feelings of pain, and some of them are overtly, they feel the pain. Okay. Sensitivity to light in shops. So when they go to shops, when they go to, like certain shops, malls in the evenings, there is a lot of light, or, discos, bars. When they go to pubs, there is a lot of lights. And that is where I have read a story where it's an actual incident where one of the teens, he went to the pub for the first time. And because the lights were so intense, he could not bear it. He broke all the lights of that pub. So sensitivity to lights, especially when they go to different areas at home, they're able to control. But when they go to new places, they find it very, very difficult to manage it. Dislike of certain colors. Difficulties around noisy traffic. As I said, noisy traffic, noisy classrooms are all triggers for them. Inability to tolerate certain smells. Distress or anxiety in busy environments. So one of these kids that I was working with, he had to go to a school. They wanted to put him into a school. They had come from outside the country, and they brought him to India, and they wanted to admit him to a school. And they had taken him for they have these tests, and they took him for the test. One thing is tests, they get easily stressed. So this boy was already stressed. And then what happened was they took him to school at a time when the children were all coming at the same time. And when children come at the same time, all of them are making all these noises. And this boy, he became really stressed. He could not manage. Parents had to bring him back. So they get really anxious in busy environments. And they're sensitive to touch. So hugging, touching does not come naturally to them. So how can you help? Being aware of autism and the differences expected from the autistic people is very, very key. Okay, being aware what is autism, being aware of the differences. So that is where initially when I started, I told you about something called as neurotypical and neurodiverse. Okay, so neurodiverse is where they are different, they react differently. Okay, the brains are all the same, but they are wired differently. So that is why it's called as neurodiverse. And neurotypical is people who behave in a certain way. Okay, people who who are advocates of autism, they don't believe that that neurotypical is normal. Neurodiverse also can be normal. So it is time that we change the definition of normality. Ask the autistic person's carers or seek advice from others. When you're providing care for people who have autism, ask them how they want to be cared for. Ask their carers, especially kids, how can you care for them? So when you put them in an ICU, just imagine the alarms that happens when they are in the ICU. So that can be serious triggers for children with autism. Be understanding, people with autism have a lot to offer, but they may need a lot of support. Consider how you can adapt the environment to decrease the sensory issues, decreasing noise, dim lighting, finding a quiet space. So this is all very difficult in hospitals, but I think if we want to have an inclusive environment, it's at schools, at hospitals, at workplaces, then we have to keep all of these considerations. Adapt your communication style. So when you are working with people who have autism, how do you communicate with them? So get straight to the point. You don't have to, give a lot of description. Get straight to the point. Speaking, very important to speak at a visual level or speak at a feeling level. Okay. So what is speaking at a visual level or speaking at a feeling level? So suppose you tell a child having autism, listen to me. Okay. The child is not going to listen. If you tell the child, look here, child will look. Okay. So using words that are visual and that have, that are related. How do you feel? Okay. Asking, I connecting with emotions. They respond very well. Something to do, they like to do it. So one of the toys that you can give for a child who has autism in the hospital has come for some other ailment. And then what you can do is giving fidgets. I don't know whether you know about the fidgeting toys. They are very, very useful for people who have autism, especially kids. Even adults use that. So adapt your care to how they are. So now let's move to the theme. So what is inclusive education? The theme is inclusive quality education for all. What is inclusive education? Inclusive education is a process involving genuine restructuring of curriculum, teaching methods, classroom organization, and this is not done one time. It requires constant effort. When the teacher is able to differentiate instruction according to the content, process, or product, it increases the likelihood that all the children, all the students can meaningfully participate in classroom activities. So this is very, very important. Inclusive education does not mean that you are separating them or you are putting them in regular class and having a common, it needs to be diverse. They need to be in a regular class. At the same time, you provide facilities in such a way, your teaching is in such a way that it caters to the needs of the diverse communities. So how do you provide education? So I have put it in a simple way. Keep the curriculum flexible. Okay. Have a lot of activities. Keep the curriculum flexible. Keep it inclusive. When a teacher is taking class, a teacher does not address only the neurotypical people. The teacher should have the class in such a way that it facilitates the neurodiverse people. Have learning activities that are cooperative oriented or cooperative centered. That means, see, one thing is there is a tendency to have a separate school for children who have autism. I don't know how much it works. One thing is, yes, today that will be my next question that I'm going to have for you. But children learn from peers. Children who have autism can learn from their own, age groups. So allowing them in an environment where they can learn together, where they cooperate and learn, the benefits are immense. So having cooperative, ways, peer-centered approach in part of as learning activities rather than isolating them, putting them in a resource class or putting them separately does not help those kids. And empowering them by having meaningful assessments. This is very, very important because assessments, generally children who have autism, they get stressed soon. So having assessments, so say for example, having MCQs or having essays, children having autism do not like to talk much. They do not like to describe much. They are to the point. So when you have an essay, they will not write. So helping them feel empowered by giving them assessments in a way that is empowering for them, not stressful for them, and making learning enjoyable and feeling it as a joy. So that is very, very important. So keeping a flexible curriculum, keeping it inclusive, having a cooperative centered approach where they learn from the peers and allowing them to feel empowered and not feel anxious and stressed is very important in a school environment. So all children can succeed in an inclusive environment. Schools are not meant for few. Schools are not meant only for the typical. Schools are meant for everybody. And that is what we need to develop. So here when I'm talking about schools, it also means colleges. It also means workplaces. It also means hospitals where you and me work. Can we have nurses who have autism in the hospitals? So these are some things for all of us to think about. So this is something that I would like to hear from you in the chat section. There is a principle of normalization that all people, regardless of their ability, should live and learn in an environment as close to normal as possible. So here I have a different opinion about normal, because what is normal? Okay, we in the medical field, healthcare field, nursing field, we are so used to saying normal, abnormal. We very easily categorize people as normal, abnormal. What is normal? What is abnormal? If you see the definition of autism, you would say that Elon Musk is abnormal. You would say Bill Gates is abnormal. You would say Einstein is abnormal. But are they really abnormal? If you consider their intelligence and where they are, I would say that I am abnormal because I am not at their level. So what is normal? What is abnormal? I think we should think about it. So I would like you to put in the chat section your opinions about it. How open and flexible. This is very, very important, and I want all of you to think about where you as a child, as young adults now, or adults with children, how open and flexible are you with people having differences, with children having differences? How are you embracing them, people who have differences? How are you bringing them into your own fold? Are you doing it? There is lots and lots of information, research, lots of anecdotes which says that children having differences, learning differences, children who are not neurotypical, they are being bullied a lot. Okay, the clients that I work with, many of the kids complain of bullying. Okay, and I have to, and they've cried, they get frustrated, they become very anxious, they go into their own shell when they are being bullied. What are we teaching our children? How are we, when we as adults accept everybody and anybody who is having a difference, you accept them and you become aware of it and then accept them. So that is very, very important. And we teach our children to accept others, to be inclusive of others. So how can you as a parent educate kids? So this is something I would like to hear from you. You could put it in the chat. I will continue. So there are some things that I would like for you to just think about is about masking. So many people get diagnosed with autism spectrum disorders at an older age. Okay, why? Because they are able to mask it. Maybe it's in a milder form, and they are able to mask it. So masking not only happens in the age group as such, but masking can also happen in school. They can be completely typical in school and then carry all that stress and anxiety, nervousness to home. So they are completely different person at home. At home, they could get violent, they could get highly stressed, they could get very triggered. And because in school, maybe they feel that I'm not, they become understanding that in this environment, I can't do it. So what happens is they control all of it and then they show it at home. So masking is something which is seen in people having autism. People having autism are highly creative. How are we using them? They are highly individual. How are we using them? They work well individually. What are we doing to help them to work in a group? So in a hospital, how can we have nurses having autism working alongside us? How can we as students have colleagues, classmates who have autism? How can we include them along with this? How can we as teachers have faculty who have autism and be accepting of them and accommodating so that things are, in place. We keep them into consideration when we plan infrastructure, when we plan teaching methods, when we plan anything in our lives, keeping the neurodiversity into account. So this is something for all of you to ponder. Role of IEP. So what is IEP? IEP is an individualized education plan. Certain schools in India also offer this to children where they are taught differently. They have certain concessions, and many of these children are also homeschooled. They don't go to. So one of the reasons why children who have autism, it's not just homeschooling for children having autism. Homeschooling is done by different parents for different reasons. Many parents who have children with autism, they do homeschooling because one thing is they are afraid of bullying. They think that the schools in India, the schools in any other countries are not well prepared or well equipped to have children having autism. So they are afraid that their children would get stressed, their children would get violent, the children will not be able to manage their emotions. So they opt for homeschooling. And then there is an option for them to write exams through National Institute of Open Schooling. So NIOS is a route for the children who are homeschooled to write their exams. So these are all, in IEP, they get a lot of concessions where they need not do certain things. Even MCQs in certain IEPs, parents can ask for these IEPs. Why I'm including all of this is for you to be generally aware. And what can you or I do? I already talked about this. Keep inclusion as your mantra. Encourage. Connect with diverse, neurodiverse people as you would connect with neurotypical people. But at the same time, be aware of their differences. Empower them, empathize them, step into their shoes. Provide spaces and opportunities, spaces, physical spaces. Provide mental spaces for them. Provide time for them. Provide opportunities for them in different workplaces, in colleges, in schools, where these children are able to thrive. If given the opportunity, these children and adults can thrive very, very beautifully. They can excel wonderfully. So this is some artwork of the kids that I work with. So this kid is, you won't believe, he's just 7 years old. And this is his art. And he asked me to put it in the website. I have it on my website. Okay. Oh, I see that he is also, very, very creative. And he sends it for, his parents have painted and framed it. Okay. So this is, and what I shared a while back, it's now you have developed awareness. Maybe many of you were already aware. It's high time for you to be accepting. So it's not just awareness, autism awareness, but I think we should change the theme to autism acceptance. If you have any questions, you can ask. Thank you.
Thank you, ma'am. It was really enlightening speech, and it's created more awareness about the autism. And really, we are honored to have you, for the today's webinar, ma'am. So we have a few questions, ma'am. The first question is why the autism called a spectrum disorder?
Yeah. Spectrum. Why it's called a spectrum? Just imagine a rainbow. Okay, a rainbow is across like this. Okay, it starts, you have different levels. So same way with autism, there is 2 children who are alike with autism. So it is across. So some will have mild, some will have moderate, some will have severe. It's varied, and no 2 signs and symptoms will match for the people having autism. So that is why it is called as on the spectrum. Shall I take the next question, sir?
Joshi?
Yes, so ma'am. One more question is there. So do autistic children have any other mental related illnesses which are associated with autism?
So illnesses as such, I would say that some of them may have, because it's on the spectrum, some of them may have intellectual, like they would have learning challenges. Okay, they would have, there are kids who have OCD. There are kids who have something called as Rett syndrome. Okay, they would have many other congenital abnormalities also would be associated. But it's not a must that every child who has autism has other abnormalities. They can be super intelligent. They need not have any physical problem. Okay, so it varies again.
Okay, ma'am. So there's one more question from Noori Khatun. Can adult develop autism later on in his life?
I don't think they can develop later in life. It would be seen, but it could be masking, or it could be of a milder form. It could be diagnosed as an adult. There are many, many adults, even with learning difficulties, who are diagnosed later in life. They get diagnosed at 50 years of age, 45 years of age, 60 years of age. So it depends on how much they are showing those, all those challenges, how much they are able to mask it and how much they are able to reveal it. So if they are not revealing it much, it may not be diagnosed. And it would be at a particular point of their life when it would be diagnosed.
Yeah, ma'am. There is a question from Srimol Mohan, and she asking, how can a social worker help autistic children?
How can social workers help autistic children? maybe identifying, children having autism may require therapies. Some children who are non-verbal may require speech therapy. They may require occupational therapy. So social worker could be the connection between the therapists and the families. So they could connect them so that they can get the necessary therapies. So I think that is one way in which the social workers could help, connecting them with different organizations which provide the treatment and therapies.
Yeah, ma'am. So there's one more question. What are some characteristics of autism? I think they're asking about how parents help with finding out those characteristics.
So how could parents identify that a child has autism, right?
Yeah, ma'am.
So a parent should become a little more alert when the child does not speak. When the child, 2 years, 3 years, and the child is non-verbal, it's definitely something for the parents to start thinking about autism. But if the child is making some, so that means child is able to speak, but the child is not verbalizing. Okay, it's not that the child is having a speech impairment, but the child is just not speaking. Okay, so then it is something for the parents to be aware, become alert. When the child is not playing with other kids, when the child is more into, when child does not like to be hugged or touched. Even the child does not allow the mother to touch or hug. If the child is not interacting with other children, child is not playing, child is looking at TV but not actually watching, child is more looking down. Okay, so that means connecting with their feeling aspect of it. So these are all signs for them to just become aware that maybe we need to refer to a pediatrician or a psychiatrist.
Okay, so I think one more same related question, ma'am. When does autism usually appear, and when are kids typically diagnosed with autism?
So, sir, it starts appearing by 2-3 years. Parents can start. It all again depends on which spectrum the child is. If the child is in a very severe kind of a spectrum, then the child can start showing the signs by 2 or 3 years of age. If the child is completely non-verbal. Generally, parents start identifying it when the child is 5 or 6 years of age. Okay, and by the time they get the diagnosis of autism, also is not so easy. Okay, sometimes the physician, the pediatricians, or the wherever they go, the psychologists or the speech therapists, occupational, they are the people who are involved in the diagnosis, and they do tend to delay the diagnosis. So the more we delay the diagnosis, the more difficult it gets for the parents to get treatment early. So ideally, I think the earlier diagnosis itself, I'm in a lot of these autism groups, and I see the pain of the parents every day when they put out that it takes 2 years, 3 years, and the diagnosis is not easy. It's very expensive. Okay, so that is, it also takes the toll on the parents.
Okay, there's one more question from Sayanthani. Are antipsychotic drugs helpful in the treatment of autism?
So there are different, it all depends on what are the signs that the child is. If the child is very hyperactive, if the child is showing signs of psychosis, if the child is having OCD, then they would prescribe certain antipsychotics, otherwise no. If the child is hyperactive, they would prescribe risperidone, otherwise no. So child can be completely free of medications and still be able to lead a successful life without any medications also, with just therapy.
Yeah, and there's a question from Anidita Das. What are the evidence-based communicative interventions for the autistic children?
So a lot of speech therapy is evidence-based, okay? And being able to communicate. So children with autism, they are very visual, kinesthetic. Kinesthetic means feelings. So keeping a lot of visuals around them, okay? Even if you want to give them directions, ask him, instead of telling them, go left, go right, go, go straight, they will not understand. Draw it for them. It's easier to communicate with them. So using more visual approaches are very useful, and they are evidence-based.
Okay.
And then speaking to the point, not Correct. Speaking too much, speaking to the point.
Correct. Okay, fine, ma'am. There is one more last question. What are services provide the Satori coaching, which offers for the autistic children?
I think those who have about that, I think I will not use this forum to speak, because that will not be ethical of me. You can write to me if you want, if you have or know someone with having autism, you can write to me, and I will, maybe you can take from Dinesh sir my number or my mail ID, but I don't think, I did not come here to speak about, I'm only put my organization's name to say that I am working with people, and I'm a, I love working with people having autism, but I don't want to use this forum for that. Maybe if you have any concerns, you can speak to sir, and sir can definitely connect you with me. Is that okay, sir?
Yeah, sure, ma'am. We can share your mail ID and phone numbers, whoever contact us for further details. And I think, Joshi, we have some questions in YouTube, no?
Yeah, sir. I have brought them to the ma'am.
Okay, now another 2 more questions added in the YouTube. If you have time, you can take it. One Punarva, she has asked some questions.
Yeah, just a minute.
Ma'am, she has asked, based on what features you differentiate a type of autism?
Sir, so how do we differentiate types of autism?
Types of autism.
They actually know. So the thing is, we differentiate them as high functioning and low functioning. Okay?
Yeah.
Autism can be differentiated as high functioning and low functioning. So people with Asperger's syndrome who are able to function very well in a social environment, then they would be called as high functioning autistic individuals. And people who are not able to interact at all with people who are very much into themselves, they have developed very poor social skills, they would be called as low functioning people with autism. So I think that is how we can differentiate. Many of these diagnoses, the diagnosis keeps changing. So I think now they have come to this thing that high functioning, low functioning individuals.
Correct.
Yeah.
Okay.
Yes, ma'am. There is a question from Alicia. She's asking, can we help autistic children to be socially active, or we have to leave them as they are?
Integrate them, include them, as long as it's not stressful for them. Yeah, do it in a way that allows them their space. Just because we are including them, we should also remember that they are different. Okay, so keeping those considerations in mind, include them. So being inclusive does not mean getting into mainstream, but being inclusive means
Okay, and this question from Pawan, I think it will be the last question. What are the screening tools to diagnose the autism in children?
So there are different tools available. With NIMANS, there is a called as autism screening tool. Exact name I remember the. I think it is called as some PACT or something like that. There are different tools available to diagnose. Even there are certain tools which does not require a therapist that are used to screen children with autism. So there are different tools. I think there's one is a PACT screening tool or something like that. So I'm not remembering the exact name of the tool, but there are screening tools.
Okay.
Indian specific.
Okay. Still questions are popping up on my screen, ma'am. Is there any therapies that are useful in treatment of behavioral symptoms in autistic children?
Sir, behavioral, no, sir. Yeah, there are behavioral therapies. There is something called as ABA that is used. It is applied behavioral analysis. ABA. There are different therapies now available. RBT. Okay, so that is rapid behavioral therapy. There are different therapies useful, but all of them have, they don't work in all cases. So that is a very unique thing. ABA also does not work in all cases. Children who are non-verbal, they go for ABA. I heard parents cry on, different forums saying that it is not working for their kids. So I think using a combination of different approaches, there is no one way to work. You have to use different therapies. You have to use different treatments. Cognitive behavioral therapy, my area NLP is very, very useful in working with children. But I won't say that there is one therapy that fits. Having different combinations of therapies is what what would help them?
Yeah, so I think we have covered all the questions. Thank you so much for your wonderful speech, ma'am, and also it's enlightening regarding the autism and autistic children. Thank you so much, ma'am. Now I would like to call upon Mrs. Gigi Mohan, lecturer, Department of Pediatric Nursing, Sarvodaya College of Nursing, to express our gratitude.
Yeah, Gigi, go ahead.
Good evening, one and all. Myself, Gigi, Assistant Professor from Department of Childhood Nursing. Take it as a privilege to propose vote of thanks to all those who have contributed towards today's webinar on account of Autism Awareness Day. I would like to express our sincere gratitude to respected resource person, Dr. Hemalata ma'am, Principal, Universal College of Nursing, Bangalore, for her excellent presentation. Thank you, ma'am. I take this opportunity to extend sincere thanks to our chairman, Sri V. Narayanasamy, and our managing directors, Mr. Sunoj Matthew and Mr. George Thomas, sir, for their constant support and motivation. Thank you, sir. I would like to express deep gratitude to our respected principal, Dr. Dinesh Selvam, and our beloved vice principal, Professor Jolie Joseph, for their enthusiastic support and guidance. Thank you, sir. Thank you, ma'am. I would like to thank Nursing Program Coordinator, Associate Professor Remia R, for her unflinching support and coordination. Thank you, ma'am. I express my sincere thanks to all teaching faculties and students from various institutions, as well as from Sarvodaya College of Nursing, who participated in today's webinar. Thank you all. I would also extend sincere thanks to our technical support team. Once again, thank you all. Thank you.
Ma'am, once again, from the side of management and my personal thing, I thank you very much for accepting the invitation. And it was a wonderful session enlightening about autism. And really, there were a lot of good responses, and people, even in the YouTube, there were a lot of chats about autism and all those things. And it's really very nice to have you on this day. We extend our very warm and special thanks to you, ma'am, for accepting. Really, thank you very much. Thank you very much. And for the viewers, we have put the feedback link in the Zoom and also in the YouTube, but some people can't click that YouTube link. So you can contact us. We will send you the link, and you fill the form through the link, and you will be getting your e-certificate for attending this conference. Thank you all very much for once again for a sweet happening of one more webinar from Sarvodaya Group of Institutions. Thank you, ma'am, and thank you, viewers. Thank you all.
Thank you, sir. Bye, Jolie. Thank you.
Bye, ma'am.
Nice.